Dr. Sandford, I know you treat a lot of adult patients with snoring, sleep-disordered breathing, and sleep apnea. And now I've heard that you are doing great things for children.
You're right. We do treat a lot of adult patients who've been diagnosed with sleep apnea, and we also treat a lot of patients who cannot tolerate the bulky CPAP mask. But what I'm really excited about is what we're doing with our children. Every night in America, an estimated 9 out of 10 children suffer from sleep-disordered breathing, and every day those same children experience a wide range of debilitating health disorders.
What type of health disorders are you talking about?
Well, it's what we found through research is that children with sleep-disordered breathing suffer from a restricted airway, meaning they are not getting enough oxygen in their lungs at night when they sleep. I also work with children who are reverse swallowers and even tongue-tied. Our oral appliance helps kids who've been diagnosed with ADD, ADHD, lower IQ, speech issues, daytime drowsiness, restless sleep. Bedwetting is a huge issue and problem, chronic allergies, aggressive behavior, swollen tonsils and adenoids, dark circles under the eyes called venous pooling, snoring, low grades in math and spelling, and even crooked teeth.
You mean children who have been diagnosed with ADD and ADHD can now get help with this all-natural oral appliance?
Yes, they can. In fact, there's a lot of research out there, including pioneer Dr. Stephen Sheldon from Lurie Children's Hospital in Chicago, whose research found that ADD and ADHD is actually a result of sleep-disordered breathing and poor quality of sleep instead of a disease. There's also Dr. Karen Bonnick from Einstein College of Medicine, and she studied 11,000 children over 7 years, divided the children into two groups, those with sleep disorder breathing and those without sleep disorder breathing. The ones with sleep disorder breathing were 50% more likely to be diagnosed with ADD and ADHD and put on medication. So many of these kids are being treated with powerful mind-altering drugs like Adderall, Ritalin, amphetamines, and Zoloft, just to name a few.
So how does your oral appliance help a child who has ADD?
We address the root cause of sleep disorder breathing by reshaping the child's oral cavity. Our appliance is specially designed to promote proper growth and development of the mouth, the jaw, and the palate. So as these areas develop more fully, the child's airway then widens and expands so that they can breathe the way they were supposed to breathe, which is through their nose and not through their mouth, thus getting more oxygen. So as they do this, many of the symptoms of the sleep disorder breathing then disappear. Research has shown that oxygen deprivation is a major contributing factor for the symptoms that we've been talking about. And when kids breathe properly, they begin to learn, grow, and blossom into their true genetic potential.
You also mentioned children who have crooked teeth. How does your appliance help with these children?
Well, by expanding the oral cavity and making enough room for all their permanent teeth, we have found that we can even prevent the need for metal braces in 9 out of 10 children. So our appliance is an eruption guidance system that treats orthodontic problems such as crowding, overbite, gummy smile, and lack of coordination between the dental arches. We start kids from ages 4 to 14 and have found there is little or no future relapse, meaning they will have straight teeth forever and may never have the need to wear a retainer. So our appliance system has the power to impact your child's health in so many positive ways, and in a matter of months, parents have seen their children transform for the better right before their very eyes.
Call our office for a free consultation to see if your child is a candidate.